Assalamu alaikum. My name is Bushra Shabi. The roll number is 28. The topic of my presentation is anti-inflammatory effects. So first of all, we have the abstract. Abstract and the objective. The inflammation is the principal response that is usually invoked by the body in order to address the injury. In this, we are going to discuss the method that is actually using to determine the anti-inflammatory effects. Then inflammation, the word inflammation is usually derived from the Latin word inflammo, which means I set alight, I ignite. So it is a natural protective response of the body to the infection or the injuries. It is used to maintain the homeostasis under the stressful conditions. Inflammation is a self-perpetuating method and it stimulates the repair mechanism. Whenever the inflammation is occurred, the inflammatory pathway are activated, the inflammatory markers are released, and the inflammatory cells are recreated, and the target tissues are affected, and then they attack the target site. So the signs of the inflammations are that is pain, heat, redness, swelling, and the eventual loss of the functions. Then we have the method. The method we are going to use is that animal selection for the carrageenan induced paw edema. I'm just telling you one thing, that is there are two type of inflammation, that is acute inflammations, chronic inflammations. Acute inflammation is a rapid onset of the action, and the signs and the severe symptoms are last for a few days, whereas in the chronic inflammations, it lasts for weeks to the month, and it is lead to the fetal death. So back to our topic, we have the animal selection for the carrageenan induced poedema. In this, we are going to use the Witzer rat. That why we are using the Witzer rat, because they have the high reproduction rate, they are calm, less temperament, easy to handle, and they are the most popular. And their weight is 180 gram. They are usually placed in the microlawn boxes. These boxes are used only for checking the anti-inflammatory effects of the drug to the rat, and they're usually placed in a control environment, that is 25-degree, and they have the balanced diet and the water ad libitum. What does it mean? Water ad libitum means at pleasure and at one desire. That is, if the rat need whatever the nutrition, they are going to give it up to the rat that how much he will gonna eat. So this experimental protocols were usually approved by the Committee of the Animal Ethics, and in this, the animals were kept in a separate cages to prevent the inflammatory areas from being licked or bitten by the other animal. So we have the model of the carrageenan induced poedema. In this process, the injection was done on some plantar regions, and the injections of 0.1 ml of 1% carrageenan solution is given. This carrageenan solution is a sulfate polysaccharide that is obtained from the seaweed. And this method, why we are using this method? Because it is easy to use, minimum equipment is required, and they have the time interval that give a hint for the duration of anti-inflammatory effect. In this, we are using the comparison of the pistachia lenticels fruit oil with that non-steroidal anti-inflammatory drug, that is a reference drug, that is linflozin. So in this, whatever happened in this experiment, that is in the Witster rats, they are divided into four groups. In the first group, no infection, no inflammation, and no treatment is given. The second is only carrageenan solution is given, no treatment is given. In the third, we are going to use as a reference, that is linconoflins. And the fourth is first the carrageenan solution is given, and after 1 hour, the pistachia lenticels fruit oil is given, that is present in the dose of 20 microliter per pound. In this, these are, that is linconophils and the pistachia lenticels fruit oil, that is rubbed, topically applied, and it is rubbed on the plantar region, that is 50 times with one index finger. In this, all the treated group, we are going to measure the size of the edema by using the digital caliper before and after the inflammation occur. Inflammation injections is occur. Edema. Edema occur after injecting the carrageenan solution. We will see that edema will occur. Edema occur due to vascular phase of the inflammation that will cause the temporary vasodilation and the vasoconstriction, which will cause the edema. The size of the edema depend upon the volume difference between the zero and the other time. And how many times you are going to check the edema, that is 1 hour, 2 hour, 3, 4, 5 hour after the carrageenan injections. So we can see that before carrageenan, for edema, after carrageenan injection, the size of the edema is increases. So the carrageenan induced poedema in the red. In this, we can see that carrageenan protocols in our lab, we are use the digital phytosometer, but in this we are using a digital caliper. Endpoint pause swelling is determined, and advantages is that it is liquid, less time course, and dose titration easily be done. And in this, the result is usually done by a graph or the plotted method, or probability chart is used for plotting the results. So we have the result. We can see that the intense inflammation occur after 3 hours. And when we give the pistachia lenticels fruit oil, we see that poedema size decreases as compared to lincophils, that is a reference. And the maximum inhibition occur after the 5 hours. In the second hours, we see that in the pistachio lenticels fruit oil, 42% only the inhibition is occur, whereas in the reference 61% occur. But after the 5 hours, the inflammation and the inhibition percentage were 61 to 16%. And at the end, we can see that the PLFO group were given 51 34 to 27% to 51.5%. So we concluded that the PLFO, that is pistachio lenticels flower fruit oil, can be used as an anti-inflammatory drug, and this pistachio lenticels fruit oil is a significant anti-inflammatory activity as compared to the lincophils. This carrageenan test is highly sensitive to the NSAIDs and has been long accepted as a useful model to determine the anti-inflammatory effects of the natural products. So we can say that this result indicate that the best anti-inflammatory activity can be obtained by after the dermal application of pistachio lenticels fruit oil on the inflamed skin. So this is my topic. Thank you. Allah Hafiz.